So you were asking me about barriers for mental health care for children, and you wanted to know what these barriers are, and then you also wanted to know what possible ways these barriers could maybe be overcome either by parents, caretakers, governments, policymakers. So that's a great question. Barriers range from the most obvious stigma, so that especially depending on your culture, it may be absolutely not okay to bring your child to see a mental health provider. Access, depending on where you live, but also, and this is very important, and one of the things that I'm most interested in, lack of recognition. So I think that there are multiple studies that document that. I think I mentioned that in my talk. If a child is really behaviorally disturbed, the system either calls him bad or notices that there is something wrong. So these are the children who we may see. And by the way, sometimes these children are treated inappropriately, but they're given medications to basically squish their aggression without really the correct evaluation to kind of understand the roots and causes and what leads to this aggression. But I would say that the children, for example, who have depression and severe suicidality are very likely to not communicate that to the adults who take care of them. There are many reasons for that. I don't know if you remember being a child, but nobody gave you a memo in a manual that you were supposed to inform your parents of the things that you were feeling, right? So they would either leak out sometimes, or they would just stay inside. So there is a large group of children out there who are probably not being recognized by their parents as having issues.